discussion is defibrotide sodium. Now purposefully I am saying here compound is not drug, because it's not a chemical synthesized drug. It's actually a biotechnology derived product. And what is defibrotide sodium and what are its uses? These things we are going to see in this presentation. So introduction first. Defibrotide sodium is a oligonucleotide mixture with the pro-fibrinolytic properties. Now what these things mean? Basically a oligonucleotide, the nucleotides which are present in our DNA, we can say, those nucleotides and the fibrinolytic properties. Now what is fibrinolytic properties? Now this is derived from the intestines of pig. The intestinal cells of pig, these properties are derived, and by mixing those two, our molecule defibrotide is obtained. Now the more about introduction, it is anti-thrombotic, they say, because see, though the FDA has approved this drug, still many scientists claim, many websites are claiming that the exact mechanism of action and exactly how this drug works in the body is still unknown. There are various pathways by which the drug acts. The basic mechanism which this drug exerts on the body is anti-thrombotic action. Now this is used in the treatment of veno-occlusive disease or disorder, that is called as VOD. Now what is this VOD? Basically VOD is a condition in which the small blood vessels of the liver get blocked. The blockages which we observe in heart in many patients. In the heart blood vessels we see blockages, and for that we use angioplasty. So same, in the liver there are small blood vessels, and those blood vessels are getting blocked because of blood clots. There is no fat deposition, because of blood clots only the veins and arteries are getting blocked. Now why this occurs? This occurs majorly because of a bone marrow transplant or intense chemotherapy. These are the main two reasons of VOD. Now this compound was first approved in 30 March 2016 with the name Defibrotide by Jazz Pharmaceuticals. This is the structure of the compound. Difibrotide, now mechanism of action. As I said earlier, the exact mechanism of action is still unknown for this product, but we are getting the results, and the main major pathway, the scientists concluded that it shows as anti-thrombotic. That means the action shown by the drug is increase in the level of fibrinolytic protein called as plasmin. So now what happens because of increased level of plasmin? When the plasmin is increased, the clotting factors, different clotting factors present in the blood are unable to show their activity. So the blood clotting level is decreased in the blood vessels, and thus it is prevented from blocking. The blood vessels are prevented from blocking. Now it is also said that defibrotide also protects the epithelial tissues of the blood vessels in the liver, but during the chemotherapy or a bone marrow transplant. So this is the mechanism of action for defibrotide. Now the clinical studies. First study enrolled 102, that is 102 adult and pediatric patients in the defibrotide treatment group with a diagnosis of VOD according to the following criteria. The bilirubin of at least 2 mg per dl and at least 2 of the following findings, that is hepatomegaly, ascites, and weight gain greater than 5% by day 21 plus post HSCT. Now can anyone here tell me what is HSCT? Anyone knows? The HSCT is hepato stem cells transplantations. Hepatocytic stem cells transplantation. We all know about stem cells, right? That is, they are isolated from our umbilical cords, and if we suffer any major injury so that we have to go for an organ loss, then if those stem cells are preserved, we can implant there and we can have the function of the organ. So because of these cases the condition VOD occurs. So these two was the main criteria for those 102 participants. Now Defibrotide was administered to the treatment of group of dose at 6.25 milligram per kg, and it was infused every 6 hours for the minimum of 21 days and continued until the patient revealed from the VOD symptoms. The study too included adult and pediatric patient with a diagnosis of hepatic VOD and multi-organ dysfunction due to HSCT. Now these methods, transplantation, whatever, by the bone marrow transplantation or here stem cells transplantation, it can cause an adverse effect. Such advanced medical techniques are still not very much fluent with our human, though our medical science is very much advanced, still some problems are there. So with 75 patients treated with Defibrotide at a dose of 6.25 milligram per kg infused every 6 hours, the planned minimum duration of the treatment was 14 days and the treatment could be continued until the signs of hepatic VOD were resolved. So in the clinical studies they proven that this compound is useful to treatment of VOD. They approved from FDA and currently it is marketed under the brand name Defibrotide. So that is about Defibrotide sodium compound.